Good morning and welcome to Compassion Fatigue 2021. First, I'd like to make some introductions. My name is Charles Gluckstein and I'm joined as my co-host, my father and my partner-in-law, Bernie Gluckstein. I'm also joined by our medical consultant, Diane Henderson, who has steered us through these seminars for many, many years. And finally, we're joined by our pediatric client liaison, Brenda Agnew. Welcome to our annual Compassion Fatigue Conference, and thank you for joining us as what we share lessons and stories focused on this year's theme of finding a silver lining. We have hosted the Compassion Fatigue Conference for 15 years. It has been our signature event. We're proud to be hosting this conference because it has become our way of giving back to so many incredible individuals who work tirelessly every day to care for others. Whether it's in a professional capacity as nurses, social workers, or family mentors, or as a personal one, as a parent or caregiver, the heart of what we do lies in caring for one another. For over a decade, we've been involved in sponsoring this day of healing and learning about compassion fatigue and the effects that the work that you do has on you over time. This past year with COVID has tested our resolve as human beings, and no one has been tested more than our frontline workers and caregivers who have had to deal with the challenges of this disease as well as caring for the most vulnerable. We are thrilled to be able to provide some important tips from leading experts about making yourselves resilient and considering these challenges and how to cope with them every day. Thank you for attending.
Hello and good morning. My name is Bernard Gluckstein, and on behalf of Gluckstein Lawyers, I'd like to welcome you all to the Gluckstein 15th Annual Compassion Fatigue Conference. Normally, we restrict our conference to 100 participants, but this year, through the magic of Zoom, we're able to accommodate approximately 1,000 participants. This year's conference is extremely important, as 2020 and the COVID pandemic has left us all vulnerable, especially our frontline workers, both physically and psychologically. So sit back in the comfort of your own home or wherever you are and allow us to give you the tools to be able to cope with the stresses and anxiety we've all had to endure this past year. Thank you and enjoy.
My name is Diane Henderson, and I'm the medical consultant to Gluckstein Personal Injury Lawyers. And you heard from Charles and Bernie previously, and they have been very busy this past year. While in a provincial lockdown, they have managed to expand our services. So this morning, let me send a shout out to Richard Halpern, Derek Nicholson, and Stephen Raston. During the pandemic, Richard has joined our firm, and Derek and Steve have partnered with us to improve our ability to provide local advocacy across the province. This will be their first Compassion Fatigue event. Welcome on board. And to all new colleagues and friends, we hope that you enjoy this experience. A virtual embrace goes out to our staff at both the Toronto and Niagara offices, and greetings to all of our old friends like Colleen Boyce, who has never missed a Compassion Fatigue event. I am all about the 3 Ps this morning: prayer, prizes, and presenters. Prayer, because the organizers all pray that this virtual event is successful and that everyone takes home at least one nugget of information that they can use personally or in their practice. Prizes, because this event is about more than an opportunity to connect with others. We will have some fun too. For those who are able to stay until the end of the event, we'll be giving away 5 $100 Visa gift cards, and I'm sure that Shelley Jingra has more surprises in store for everyone. Be sure to complete the form in the chat box to enter your name into the draw. The third P, presenters. The presenters joining us today will be sharing stories of struggle, triumph, empathy, and support to help us understand what compassion fatigue is all about and how we can learn to care for ourselves and each other. I will not reiterate the speaker spotlights. They're on our web if you care to view the web, and were sent to you previously through your email and Facebook, etc. So instead, I will tell you some interesting details about each of the presenters.
Hi, everyone. For those of you who don't know me, my name is Brenda Agnew, and I am a client liaison with Gluckstein Lawyers. I'm so excited to welcome all of you here today to our Compassion Fatigue 2021 conference. We were disappointed last year that we were not able to offer it in the traditional way that we normally did. And we've had to make some adjustments this year to take things virtually. But we have a fantastic lineup of speakers, and I think everyone's really going to enjoy and take something away from today. Just a little bit of background on me. I am a former client of Gluckstein. My younger son, McLean, has cerebral palsy, so he has a brain injury, and we met the team in 2009 when we approached them to take our case on. And true to their full circle care, they brought me on to work with the team in 2018 to help to support families like mine that are going through the legal process, and just to try to provide them with resources and information along the way that they might need as they go down this journey. So I'm thrilled to be a part of the Gluckstein family. I'm thrilled to be a part of this day. Again, it's one of my favorite events that we do. And I thank Diane and Bernie and Charles for their dedication to this event and for all of the effort and support that they put into it so that we can bring it to all of you. So enjoy. I hope you all learn something. I know you will. The speakers are going to be fantastic. And hopefully next year we'll get to see everybody back in person again. So have a great day and enjoy Compassion Fatigue 2021.
Mother and wife and winner of many awards, including the Inspiring Physicians Award, our keynote speaker is the past president of the Ontario Medical Association. She was a delight to get to know. We hope that this experience will be the first of a long list of engagements that we share with Nadia in the years to come.
I'm grateful. In a year that was so tumultuous for so many, my life remained relatively stable. I have my kids, I have my husband, I have my parents and sisters, I have my house, my work, I can afford food, I can afford my mortgage, I can afford school supplies, medications, and so on. There are so many people who can't, and so many of my patients who can't. And so I tell myself, count your blessings, be grateful. And I am grateful. But I'm also tired. I feel anxious, bruised, broken some days. And though I feel blessed to do the work I do, I know my job has demanded physical sacrifice, it's demanded mental sacrifice, it's demanded emotional sacrifice. It has demanded that I leave the people I love to help those whom I barely know. And though it fulfills me, it's left its scars. Compassion fatigue, moral injury, burnout, whatever you call it, it is the cost of caring. That's what it's identified as in the literature. And this year marked by COVID-19, by a pandemic that has upended the world's healthcare systems, economic systems, its social systems. This year, out of all years, the price has been higher than ever before. I'm going to use some stories to illustrate what I mean. And I then want to talk about how maybe together we can make things better. But here's the disclaimer. Patient and worker details have been changed, and in some instances, aggravated. And that is to protect their privacy. I bear witness to many, many lives. And I hold them in such high regard. I value them. They are precious to me. And so I fight to protect their privacy, particularly because I do live in a small town. My name is Dr. Nadia Alam. I'm a family doctor and anesthetist who works out of Halton Hills, Ontario. Halton Hills is a small, beautiful town that's nestled between Brampton, Guelph, Mississauga, Milton. We have one highway sign off the 401. We're about an hour southwest of Toronto on Google Maps. In reality, with traffic, or the way traffic used to be, we're about a couple hours drive. In many ways, Halton Hills is like a small town. People know each other. We have a small newspaper that we all read and contribute to. It's a small community among the healthcare workers, all the nurses, all the respiratory therapists, a lot of the ER physicians, a lot of the administrators. We're all neighbors. A lot of my patients are neighbors of mine. So it is not surprising that I will go to the grocery store and I'll run into my patients. It is not surprising that I'll stand in line at the bank and I'll run into my patients. So that's me. My patient, Joanne, calls me one day. Her voice is panicked, her distress making her voice shake. Dr. Alam, I walked off my job today. I couldn't take it anymore. Oh my God, I walked off my job. You see, Joanne is a nurse. She's worked in a long-term care home for a number of years. She is a career nurse in the job for 33 years. She's tough as nails, calm under pressure, compassionate, intelligent, and perhaps a bit too self-sacrificing. For months now, she's worked overtime, double shifts even, helping where help is needed, night shifts, day shifts, cleaning bedpans, bathing patients, giving them medications, tracking their symptoms, helping to manage chronic diseases, frailty, dementia, end-of-life care. The reason why you're in a nursing home in the first place, or a long-term care home, they're both the same thing. The reason why you live in a nursing home is because you need 24/7 help. You need someone there all the time. You need someone there to help feed you. You need someone there to help you get out of bed. You need someone there to help you get into your clothes, get dressed, put into a wheelchair or a chair, or helped with a walker to a room. You need someone there all the time. And nurses like Joanne are there all the time. The patients, she said, her voice quiet, tired, they're so sick. They need so much. It's not just COVID, it's everything. The other nurses, the PSWs, the RPNs, everyone, they are like family. So when they're sick, when they can't make it in, when they need help, you step up. You care because they are your safety net at work, so you become their safety net. So Joanne stepped up. and stepped up and stepped up until she broke. And then she walked off her job, emotionally spent. I put her on leave. We spoke to her manager. And then a few days later, few days after she'd been at home, she called me, and her voice was back to the way it always is. Calmer, brighter. Dr. Alam, she said, I went for walks. I sat with my husband. You're right. I was burned out. And bit by bit, she recovered. But after a week off, she went back. She insisted. She knew how short-staffed they were, how desperate they were at work. And so she took the bare minimum for herself, and then she went back to work. But this time, when she went back, I put protections in place. And it's because I couldn't rely on her to say no, to recognize when she was overworked, when she was overstretched, when she was buckling under the demands, under the pressure. So I put protections in place. She can work overtime, but no more double shifts. She has to have Fridays and Saturdays off. None of this 2 to 3 weeks of working straight without a break. No more. Compassion fatigue, burnout, exhaustion, emotional exhaustion. It all kind of sneaks up on you. You can't see when you're in it. I know because I've been there too. And sometimes, actually, more often than sometimes, more often than not, you need someone on the outside to see that you're drowning and to wade in and pull you out. To do this job right, to work in healthcare, you have to empathize. You don't just understand the lived experiences of another person. You don't just hear about their struggles, their vulnerabilities. You share their feelings. You feel what they feel. Healthcare demands that we give our hearts again and again. Caregiving demands the same. And so you look at a patient and see them as Mrs. Dispenza, 91 years old, with dementia, COPD, atrial fibrillation, heart failure, kidney failure, the list goes on. You also see them as Maria, Isabella's mom, who used to be a nurse in Italy, who immigrated to Canada 50 years ago, stayed home with the kids while her husband Joe worked as a bus driver, a taxi driver, worked 7 days a week. Maria now lives with her daughter Izzy now. And Maria is your patient. She starts her day, each day, sitting at the bedside, and her daughter dresses her, carefully helps her put on her underclothes, helps her put on pants, helps her put on a shirt and a sweater. And Maria turns to Izzy, and every single morning she asks, "Where's Joe? Did he leave for work already?" And Izzy quietly explains again, every single morning, "Joe died 5 years ago of lung cancer." And every morning she sits with her mom as her mom weeps. One day Izzy came to me and she said, "I found my mom wandering the streets looking for dad the other night when I got home from work. It was -1 outside. She had no shoes, no coat." And so we talk about how hard it is to take care of someone as frail as her mom. I talk about growing up in Pakistan and cleaning up after my great grandmother, who also had dementia, and helping her just with the basics of life and how hard it is. Because you are taking responsibility, not just for living your own life, doing your own thing, but you're taking complete responsibility for helping another person literally live out their life. We talk about nursing homes. Izzy and her husband are getting to the end of their tether. They're exhausted. It's become too hard. They're worried. They're sad. They're wrung out. But the thought of putting Maria in a nursing home is frightening. COVID-19 has upended everything we took for granted. Being able to visit our loved ones in nursing homes, being able to take care of them, knowing that they're safe. The highest number of deaths from COVID-19 have not occurred in the hospital. They've occurred in nursing homes among our most vulnerable elderly people. People who've more often than not died alone, holding the hands of a stranger, a nurse who cares, a PSW who cares, a doctor who cares, but it's not the same as family. Being able to accompany our critically ill family members in hospitals, being able to sit with our critically ill loved ones in nursing homes, it's all been taken away from us. We have taken people who are at perhaps the most vulnerable point in their lives, and we've isolated them. And yes, it's out of protection, but it's come at a price. And sometimes I wonder if the price is worth it. We all wonder. One night, I'm in the COVID testing center, and a man comes in, a recent immigrant from India, who had been well for months until this week. He was an engineer who now worked in the grocery store. He had a fever, that's it. And so Aziz, he sat across from me, his back straight, a slim older man of about 54, dressed in jeans, a white t-shirt, a blue turban. He has high blood pressure, diet-controlled diabetes, but is generally well. He spoke to his family doctor because his fever had persisted for about 5 days now. And at his family doctor's request, he booked an appointment, drove himself over in his son's rusty old Toyota to get a COVID swab, and then go home for dinner. I check his vitals. Heart rate 62, oxygen saturation 84%. I stop. Why is the oxygen level in his blood so low? I look at him. He's sitting, breathing quietly, no nasal flaring, no tug at the base of his neck, no chest heaving, no wheezing, nothing like that to suggest that he's having trouble breathing. I wipe the SAT probe down, thinking maybe it's a machine error. I check the machine on my own finger, 99%. That's normal. I wipe it down again, put it back on his finger, 83%. Doctor, he asks, what is wrong? I don't know. The pieces of this puzzle don't fit, but I've seen enough to be worried. So I explain, I swab him, but instead of sending him home to dinner, I send him to the nearby emergency department. As he leaves, I hear him call his family on his cell phone to let them know that he would be late for dinner. Don't worry, he said. I will be fine, he reassures them. Later that evening, I learn Aziz was admitted to hospital. His chest x-ray showed lungs filled with disease. His COVID swab came back positive. And as I leave to go home, my breath fogging in the cold winter air, I see Aziz's rusty old Toyota in the parking lot. And I wonder, will anyone come to get the car? Or will it rest in the parking lot forgotten as the family grapples with Aziz's sudden deterioration? Later that night, I hear Aziz crashed. He was intubated, put on a ventilator, transferred to ICU at a larger hospital, and a few days later, he died. And just like that, all his work, all his plans, everything stopped. His life took a sharp turn. And everything, the trajectory that he'd been on, the road that he'd been on, that immigrant dream that he was living, that I have lived, of work hard, take care of your family, succeed so that your kids can work hard, take care of their family, and do better than you. All of it was gone. All those plans were gone. And I think of his family, and it makes me think of mine. My husband and my young kids. My oldest is 11, and then I've got 3 others after that. I've got 3 boys and a girl, 11, 9, 7, and 5. The girl's the youngest. And they have so much potential ahead of them. And I think, what if my life takes a sharp turn? And then I shy away from that, finishing that thought. This job is hard. It's ever present. Healthcare runs 24 hours a day, 7 days a week, 365 days a year. And to do that, people like me, people like other doctors and nurses, like porters and lab techs and security guards and x-ray techs and administrators, RTs, PTs, and so on. We all work 24 hours a day, 7 days a week, 365 days a year. It has never been a 9-to-5 job. This is what healthcare has always been like. This year, though, the pressure, the uncertainty, the workload has made many of us reach a tipping point. We worry constantly. If we get sick, who will cover? Who will take over? If I get sick, who will cover my OR shifts, my Code Blue team shifts, my family medicine clinic shifts, and all the investigations and results for the 500 patients that I've promised to take care of? Who's going to do the house calls that I've booked for my complex, frail, housebound patients? And the part that makes my heart hurt, what about my family, my kids? And that's where I stop, because I can't think further. This job demands that we be well 100% of the time. Our skills are so specialized that if one of us falls because of illness or circumstance, we all start to fall like dominoes, particularly during the pandemic. I work in an industry where I watch lives change their entire trajectory because of illness, unexpected as it is. I work in an industry that depends on its workers being well all the time, being immune to illness. COVID-19 has laid bare the faults in our system, and we don't have enough protections in place even for ourselves. It doesn't just mean sick patients, it also means that the rest of us, because we're human too, the rest of us can get sick, can't work, can't care for our patients, can't care for our families. It means that we must somehow be replaced when replacing us is already a significant endeavor under normal circumstances, under non-pandemic circumstances. I sit at decision-making tables at local, regional, and provincial levels. I'm interested in health policy. I want to make the healthcare system better. I want to leave the world a bit better than how I found it. And healthcare is the industry that I've devoted my life to. And I'm surrounded by CEOs, government representatives, other doctors, managers, organizational leaders, powerful people who make decisions at the local, regional, and provincial levels. And one day, I was sitting, listening to the conversation around me. And Darla, the CEO of Home Care, says, "We've pulled out all the stops. We've tried everything. But guys, we're operating at 120% with 20% less staff than before in home care. We've been able to hire at best 5 PSWs since the pandemic began." And her voice is shaking. Andrew, the CEO of the hospital corporation, adds in, "We're stretching to meet demand too. It's been tough. I know where you're at. Our staff and physicians have done incredible work, but we're trying to hire more staff to work in the vaccine rollout, in the testing centers, the ICUs and COVID wards and the field hospitals. We're pulling out all the stops too." And Darla laughs bitterly. "Oh, I know. We're losing more workers to you every single day because you pay better and you have benefits. You can offer benefits. You have more funding." And Andrew nods. "I know, I'm sorry." Darla sighs, "Don't be." The hospital is an important part of our healthcare system. And she admits, "I'm worried. I don't know if I have enough nurses and PSWs to meet the anticipated demand for palliative care, let alone the expected demand for home care." And so we put our heads together. We shuffle the deck and we try and figure out a different configuration of how to stretch our resources so that we can do more with less, because people have gotten sick, people have retired early. This pandemic has shown, has revealed what a shortage there is in our system. The thing to remember is that the healthcare system is so much more than bricks and mortar, shiny medical equipment and beds and negative pressure rooms and ventilators. It's people. 70% of the healthcare budget goes to paying for someone's time, skill, and training. 70%. Healthcare is a people-powered, people-centered industry. And we're realizing more and more that we do not have enough hands to help everybody who needs our help. So how do we decide? How do we decide who gets the help? How do we decide whose need weighs more heavily than someone else's need? How do we navigate a system where we have to triage basic care? Because we're talking about not just how to stretch life-saving equipment and resources and people. We're talking about how do we stretch people who help, PSWs who help frail patients out of bed. It feels like we're all standing on a tightrope. And the only reason we're still standing is by holding one another's hands. But we worry, what happens? What happens when one of us falls? Because the statistics show eventually one of us is going to get sick. People who fall sick are at their most vulnerable. They come face to face with their mortality. COVID-19 intensifies that suffering. In and of itself, it can be nasty and unpredictable. In some people, there are no symptoms. In others, there are months of disability and hospitalization and rehab, and in others, life-threatening complications. But a community confronting COVID-19 finds itself robbed of freedom, of comfort, of company, of certainty. Josie tells me she and her son sat outside her husband's window every day watching while inside he lay in his hospital bed, weak, thin, unable to eat, whittled down to skin and bones, battling pancreatic cancer. That was the closest they could get to him. They sat outside his hospital window. He kept his phone plugged in, turned on, so that at least he could hear their voices as he fought to survive. And then I think of a baby. She is Drew and Helen's miracle baby. Years of infertility treatment, a pregnancy fraught with fear of miscarrying, of premature delivery, and then finally the big day. Helen labors and labors and labors, gets an epidural, labors some more. The first time is always the longest. And then all of a sudden, she needs to go to the OR for a stat C-section. The baby's in trouble. But through skill, persistence, luck, it all works out. And I hand this tiny little baby over to her parents. And remember how not that long ago, I was holding my own newborn baby girl. I remember my parents, my in-laws, my sisters, my cousins, everyone coming to visit in those first few days. And a part of me mourns that this miracle baby is going to get a quieter entry into a world where families cannot observe that time-honored ritual of gathering to welcome new life. One day, leaving the hospital, I see a husband kissing his wife at the door, unable to follow her inside. She's coming for surgery to remove her breast cancer. Her skin is pale, her eyes tearful. She adjusts her toque, her red toque, and I see her shaved head underneath. She's obviously had chemo. He holds her and then lets her go, and she walks alone into that hospital. And the doors close behind her, and he stands there watching until he can't see her anymore. And then he drives home to wait. Or I think of another patient, Roger, a chronic pain patient, or a patient with chronic pain. He waits anxiously for the implantation of his neurostimulator. He has had pain for years, and we've struggled to manage it with medications. We've tried to do interventional therapies for his pain. And then we think of a neurostimulator, and he gets accepted into the program. In March, he gets to trial a neurostimulator for 1 week. For 1 week. That 1 week, he learns what it's like to sleep at night without pain, or well, minimal pain. It didn't take it away to zero, but it made it bearable. He learns what it's like to be able to play with his young kids again because his pain is controlled, finally controlled, and he feels like he's tasted freedom. The week he was supposed to get his procedure, the province declared a state of emergency, and he was delayed again for months. I remember Sarah, a young mom with 3 kids, who calls me. We do a virtual visit, and her voice is tense on the phone. How are you? I ask. Fine. She says, just fine. She needs a refill of her birth control. Are you alone? I ask. Sounds like a weird question, but it's actually really important. No, she says, and I know her husband is there and that he's lost his job. And now his kids and his wife are locked up at home with him. A man who yells at them, frightens them. He doesn't hit her, but it's tense. It's walking on glass. And every night since April 2020, this is what they've struggled with. And so I faxed the refill because we cannot have her get pregnant again. It got pretty bad the last time. I think of being on call last night. I intubate Roop. She has complications of COVID and has to go on life support. I push drugs through her IV. I put her to sleep, put a plastic breathing tube down her throat, hook her up to a ventilator. Her life is at a crossroads. She'll stay sedated now, waiting until her body either recovers or she dies. And as I finish stabilizing her, I see her phone still clutched in her hand as she's fallen asleep. Ring and ring and ring and goes to voicemail. A picture flashes on the screen. Roop in better times, laughing, her head turned, her husband's arms around her. Rajwinder is the name that flashes on the screen. And I wonder, did she get to say goodbye? It all happened so fast. She deteriorated so suddenly. Will she ever get to see him or speak to him again? And I have to hope that she will. It's the only reason to try and put someone on a ventilator, put someone on life support. But the reality is that Roop has up to a 70% chance of dying once she goes on the ventilator. That's what it means to be so sick from COVID that you need ICU, life support, a ventilator, an intensivist, and critical care nurses helping you. That's what ICU means. So I love my job. I love the complexity, connecting pieces of the puzzle, helping people find conclusion and closure. I love the relationships, connecting with people in the ups and downs of life, following them through from beginning to end, cradle to the grave, right? I love being a family doctor, but I'm haunted by the suffering I see that I am unable to stop. Healthcare workers self-select and are selected into their professions for their empathy, right? And I talked about this earlier. Their ability to feel the pain and the joy of another person's life, that ability to understand not just the weight of another person's needs, but more importantly, their values. What do they want? Empathy makes you a better doctor, a better nurse, a better PSW, a better administrator, a better every kind of healthcare worker. But empathy also means that the suffering you bear witness to cuts deeply as if it was your own. And some of those cuts heal, but many of them become scars that mark your heart. They talk about this term, moral injury, and I referred to it earlier. It was first used, I'm not sure which world war, but it was first used to describe the way soldiers felt, how soldiers responded to their actions in the war. That sense of perpetrating or failing to prevent or bearing witness to or even just learning about acts that transgress deeply held moral beliefs and expectations. I became a doctor to help people. And when I can't help people, and when it happens time and time again, it starts adding up. It has a profound impact on well-being. And that's the crux of moral injury. That's that trauma, those cuts are the crux of compassion fatigue and burnout. Back in 2018, the Canadian Medical Association did surveys on physicians. And they found that about 1 in 4 physicians across Canada were just burned out. Women more than men, but they were just done. The others were in various stages of burnout. Some of them felt great. Some of them were happy, but others felt tired. Others felt like they couldn't show their vulnerability. They could never make a mistake. They were struggling. They felt like they couldn't care anymore. They felt useless. They felt powerless. In 2020, the CMA, or the CPSO, the Canadian College, the College of Physicians and Surgeons of Ontario, they did a survey on burnout as well. And they found that in Ontario, 20% reported that they were in survival mode. That's what it felt like. This sense of being so fragile that anything could tip you over the edge. So when you think about this, and you think about, well, how do you fix this? One, it's by talking about it, raising awareness so that insidious as it is, sneaky as it is, how it slips into your lives and you don't recognize it until your head's underwater. Raising awareness is really important. Making space so that people feel safe to talk about struggling. So not just stopping at, how are you? I feel fine. But pushing it further and saying, no, how are you really? Or reflecting back, you sound like you were struggling the other day. If you want to talk about it, I'm here. And then just listening. Not trying to solve their problems, because this is the kind of thing that studies have shown is not very easy to solve. It is a multi-layered, complex, multifactorial problem. It's when you look at the IHI, the Institute of Healthcare Improvement framework for joy in work, there are a lot of factors that go into what gives people joy in work. And when you think about which factor has to give way, what things have to break for a person who is built to be tough, to have stamina, to be resilient, to work hard, to accept sacrifice, to accept sacrificing oneself for others again and again and again and again. What does it take to break that person? You realize a lot of those factors that go into bringing joy in work have to fall off. And there are things that people can do themselves, right? People talk about self-care. People talk about taking time out, making sure you're rested, making sure you eat well, making sure that you exercise, making sure that you connect with your social network, the people who are important in your lives, your loved ones, your kids, your parents, your siblings, your close friends. But that helps maybe take away 10% of burnout. The rest is a system level responsibility. And that's why I went and got a master's in health economics, policy and management. That's why I push myself to try and make the system better. Make the system work more seamlessly, not just to help patients, but to help the people who are taking care of patients, the families, the caregivers, the healthcare workers, and everybody else who is involved in taking care of a person at the most vulnerable point in their lives. It means looking at all those pieces that produce joy in work and working to bring them in, making sure that they feel safe, making sure that they feel seen, they feel heard, they feel valued, making sure that there are systems in place to pay them properly when they're well and at work and when they're off sick, making sure that there are protections in place so that they don't feel like they have to sacrifice them constantly just to hold up the healthcare system. Those kind of system level decision making, they become so important in healthcare because, again, in this industry, you normalize giving of yourself. You normalize leaving the people you love, leaving the things you love to help take care of people you barely know again and again. That is the job. And you show up and you step up every single day. And it's tough. And it's been tough. But at the end of the day, I honestly feel that it's worth working for. People get sick, people get hurt, and people like me will always step up to help them and to care for them and take care of them. And so we need to make sure that we've created an enabling environment that lets people like me do that job that we all love. So the thought that I want to leave you with today is that when you consider the health of the people who work in healthcare, it's important to realize that it goes way beyond what's happening at that individual level. We know that it includes factors on not just the individual level, but the sociocultural level, the occupational level, systemic factors that not just contribute to not just physician health, but the health of healthcare workers, but that give you an opportunity to affect change. And so this is my challenge to you, to the people who are watching this. Think about how you help support the people who will care for you if you should fall ill, if your loved one should fall ill. It's more than just standing on the street and banging pots. That is deeply appreciated. But my challenge to you is, how are you going to contribute to make the system better, make the system more supportive? What can you do to help? Fixing, I think, is not the word I'm looking for, but help improve this epidemic that we're seeing among healthcare workers, among even healthcare administrators, of moral injury, of compassion fatigue, of burnout, especially as we're coming out of the pandemic. That's what I'll leave you with today. Thank you very much for taking the time to listen to me today.
Our second speaker was introduced to me by a client during a virtual mediation. I don't know if you know about mediations, particularly virtual ones, but there are a lot of breaks during these types of mediation. Therefore, there's lots of time to chat. She told me this story about a fellow who had helped her husband. Her husband is an ambulance driver who experienced PTSD. The fellow who so generously helped him is named Graham Bettis. I can't believe that I hadn't heard of Graham and his group, the Valhalla Project, before. Graham is one of the most articulate advocates that I have ever met. I hope that this event will be another start to a long-term relationship.
Good morning, folks, and welcome to the online conference for Compassion Fatigue, Finding a Silver Lining. My name's Graham Bettis. I'm going to give you a little bit of an introduction about myself and how I first came into contact and exposure to compassion fatigue, and then we'll move on from there. Just by way of introduction, I'm a director for the Valhalla Project Niagara. Our specific purpose is to assist in the management of PTSD for veterans and first responders suffering from PTSD. We're a nonprofit organization, and we offer all of our programs at no charge to the participant or the agency, as we already feel there's enough barriers to treatment. So we don't feel the need to add expense of any sort to that. So just a little bit of my background. I was a reservist for 12 years with the Canadian Forces, and that included an overseas tour when I was 19 years of age. Upon my return, I joined a major police force in the Toronto area, and I'm coming up to 30 years on that. About 15 years into my career, somehow I felt a draw towards peer support. And I began to take part in my agency's peer support team, eventually getting trained up as an instructor and able to certify teams. Along the way, I was picking up traumatic events. And unbeknownst to myself, I most likely had PTSD from my time in the military. As I moved into organizational wellness, which is a bureau specifically to deal with the mental health aspects involved in policing, I began to take a master's in counseling psychology. And while I was there, I had exposure to actually lead and help run our peer support team. And with that in mind, I began to see and began to become aware of how compassion fatigue can start to set in on people that are helping. Now, just a little bit of a clarification. A lot of people have always felt that compassion fatigue is basically burnout. And to a certain extent, they're not wrong, but compassion fatigue has that empathy and that compassionate component to it that really makes it different from burnout. Not to denigrate anybody's careers, but hardworking stockbrokers and hardworking bankers and hardworking anybody who does long hours in their job can get burnout. But we're looking at specific either jobs that entail a compassion component to that relationship. Also included in this can be caregivers if you're the primary caregiver for a family member as well. So it doesn't always have to be in the cause of employment. Now, just a little bit of a precautionary tale. Prior to me going into my position in organizational wellness, one of the officers assigned to the Bureau basically had to be transferred out of the Bureau in order to maintain their mental health. And this was not with their consent. They did not want to leave, but the organization felt it was in the best interest of this officer in order to have them move along and not be subjected to that sort of trauma or that increased pressure on their system. So that's how I first became aware. And as a precautionary tale, it kind of turned around to bite me. I was asked a question on why somebody was transferred out of the Bureau, and I gave what I thought was an honest answer, saying that, the job was starting to affect them. So for their own, safety, they had been transferred. This was before me and whatnot. However, that generated a human rights complaint, which was eventually settled. But to that extent, and I'm not sure I have the answer to how to kind of force an awareness on employee or how to kind of force treatment on the employee. it can definitely be a bit of a minefield that you have to tiptoe through. But that being said, my background is predominantly in PTSD, but as I was looking at the symptoms, there were so many comparisons. Now we're just going to rewind just a touch, and we're going to look at a time to when we were healthy. Sorry, I'm just going to take the screen off here. Now I'm going to look at a time to when we were all healthy. And when we're all healthy, we kind of have these 5 switches within us. And arguably, they're going to be in a positive position. Now, at various times in our life, they may move into the off position, but they all have the ability to switch back on. And those 5 light switches that we have are trust. You have to, when in a healthy person, you have the ability to extend and receive trust from people. The next one is safety. Again, when you are in a healthy state of mind, you have the ability to feel safe, and the also ability to have that awareness in yourself that when you don't feel safe. The next one, and certainly one that's impacting on all of our lives with the COVID-19 crisis, is the ability to feel that you have positive control of your life and your decisions and what's going on around us. Arguably, right now, with all the lockdowns and such, the ability to people to feel a positive sense of control can be in the off position. The next one is intimacy. The ability to engage in intimacy and positive relationships in a healthy person is always there. In somebody who's not healthy, they may not have the ability to engage in intimate relationships. And the final one is self-esteem, the ability to have positive self-esteem. Now, somewhere along the line, hopefully, we became aware that there was something wrong with us. And we may not even realize that these light switches exist. As we become more aware of what our condition can have in store for us, that is where we can find the proverbial silver lining. And we can eventually find ways to move those switches back into a positive position. And part of that is we may not have been aware that they were specifically turned off because of the pervasiveness and the subtlety of compassion fatigue. We find ourselves not all of a sudden just being noticeably different. It's been a slow and subtle shift, but then one day you kind of realize, I don't feel good. And as we look back at it, perhaps these 5 switches are in the off. So with that knowledge, we can move forward. And as we look at some of the actual symptoms of compassion fatigue and compare them to the symptoms of PTSD. These are the symptoms of PTSD. Now, if we look at the symptoms that commonly manifest themselves in compassion fatigue, we have isolation, and that's right in there under the 3rd column of feeling alienated. Now, I should point out that the symptom clusters for PTSD have 5 major clusters. The first one being the exposure to the trauma, which is pretty much the only cluster that you folks aren't able to fulfill, is exposure to a specific trauma. For the most part, you are dealing with someone who is dealing with those traumas or those illnesses or whatnot. Exhausted, both physically and mentally. That is in the column C as well. Emotional outbursts, that's in the echo cluster, or the emotional reactivity over here to the side. Physical ailments such as aches and headaches, those commonly manifest themselves. There's been a lot of, while not specifically mentioned as a symptoms, a lot of gastrointestinal issues, including appetite. Substance abuse is usually present in PTSD. There's a sadness and apathy that is there, and here are clearly in the Delta clusters. And I should point out that PTSD is usually comorbid with both depression and anxiety. So you get to feel the ups and downs. And in addition, there's that inequality towards the therapeutic. So you can start to feel distorted blame against the person that you're caring for or helping. These fall right in line with negative beliefs about the self and the world. And as you can see, not always present, but you can get flashbacks or intrusive thoughts and nightmares as you start to take on and live through the stories that have been passed on to you through your clients. Now, for the most part, I'm going to be discussing my examples from a peer support worker or a therapist or a counselor or a social worker type of aspect. But I do fully recognize that there can be family members where you are a primary caregiver. So you may have intrusion in your life, and that could be either through traumatic memories or thoughts. And you may have a certain amount of avoidance in thoughts, feelings, people, places, conversations, activities, objects, and situations. And things that you see may remind you of those stories or those traumas that have been explained to you through the healing process of your clients. The good news is we have the ability to move on. Because once we have an awareness and we're realizing that we're sick, and we get that kind of diagnosis, or in this day and age, we do a Google search and we try to figure out what's wrong with us. And for the most part, you may be able to get that diagnosis. An official diagnosis, of course, has to be done through a medical or healthcare professional. But that being said, once you have that awareness, you can really begin to have your healing journey really start. And PTSD and compassion fatigue, I have a firm belief that they are healed through the heart. There's not a medication that you can take that's going to magically heal this. Now, medication may indeed be part of your healing path if your healthcare professional feels that your symptoms are robust enough that medication will aid in taking care of some of those symptoms. Then that's appropriate. But for the most part, you are going to find relief in other areas. A key one being education. This is one of those situations where having an education of what is basically ailing you can show you the path to that healing. And with that, one of the big things is, again, it's healed through the heart, and it's healed through positive activities. And it's a concept known as behavior activation. We begin to become almost depressive in the way we're operating, and we alienate ourselves from people, and we become disengaged from others. And with that in mind, there's certain tools that we can always have. If we look at the Road to Mental Readiness or the Working Mind program that's prevalent in a lot of law enforcement agencies and in our military, they have those 4 great working tools that they didn't invent by any means, but working tools that they've kind of grouped and really heavily encouraged. And those working tools are SMART goals or goal setting of any kind. And that basically gives you something to work towards. Breathing. There are several different breathing styles, but the first one is just to always be breathing. I personally ascribe to 5 seconds in, and I try to use horizontal belly breathing to the extent that I can. But besides that, I don't hold my breath. I try not to go quick and shallow. I just try to take nice, deep, full breaths. The final 2 working tools are visualization and positive self-talk. So you can work yourself through positive self-talk. You can convince yourself, and you can say to yourself, these aren't my memories. These aren't my stories. I don't have to deal with them. I can put them behind me. Because it's not your job to carry the trauma for your clients. It's your job to give the people that you work with working tools and ways to essentially heal themselves. As I said, you may have found yourself with some forms of substance abuse, and having knowledge of the fact that you're using an addictive behavior as a coping skill in the beginning And don't get me wrong, in the beginning, the use of alcohol and drugs can take care of your symptoms. Problem is, it's creating another problem once you have a reliance on those negative substances. So that being said, having that awareness that it was being used as a coping skill, now we can move on and find other coping skills like meditation and positive activities and exercise. I encourage people to try all these different things out on our program, which we've converted to an online Zoom program, 10 sessions over 5 weeks. Each session, we give them some information, and then we give them some, and then every session we demonstrate and have people work through a coping skill. Some of the coping skills that we utilize are basic breathing. Then we move on to a mindfulness drill, which contacts our 5 different senses: our sight, our hearing, our sense of touch, our sense of smell, and our sense of taste. All things we can do while holding a coffee cup and making those observations about our coffee cups. Other coping skills: progressive muscle rate relaxation, which puts us in touch with our body and how to relax it. There's a vocal chanting one that I use quite often. It's a 5 meditation, and it brings you through all of the vocal tones and acts as a bit of a vocal warm-up for our aspiring musicians in the audience, type of thing. This is one that I really utilize a lot. We teach journaling. And the big caveat that I say to people is if you're from a medical profession where you're used to documenting things, sometimes journaling can be difficult for you because you've been such a studious note taker, and you've probably never used your feelings or your sense of awareness in your journaling. So we have a couple of instructors teach in it the various ways to journal. And the key things that I kind of take away from journaling is you're there to keep track of your emotions and your senses. And it doesn't matter what you're discussing. You can pick anything that you see and then just discuss your senses and your emotions. And looking at a guitar may evoke a positive memory back from the campfire back when you were 16, and that's maybe where the journaling may go. But it doesn't always have to feel, when I first started journaling, it was, I feel dark and this and morbid, and these are my negatives and these are my negatives. And days in and days out for about 2 or 3 weeks, it was all the same. So I would stop doing it. And then somebody said, no, that's not what journaling's about. Journaling is about taking back your life. And to that extent, if you don't have anything to journal about, start with your morning gratitude. And I do my morning gratitude in a couple of stages. I write down the things I'm thankful for. Then I have another column, why. And then my final thing is I contact that person. I tell them why they're important in my life or why they had an impact in my life. I had an occasion a few months ago. I'm living in a great new place in Niagara-on-the-Lake, wine country. And hey, the person who hooked me up with this living accommodation, I sent them a note saying, hey, I just want to let you know that, I'm very grateful that you're in my life and you were able to make this connect for me. And they wrote back saying, thanks. It's a good feeling. So it goes 2 ways. So that's the way I use gratitude, and I can use journaling. And keep in mind, I'm not sure what the age demographic here, but a lot of us think that journaling has to be done in the written world. There's several apps out there that we can have on our smartphones where you can dictate your daily journaling. Or you can do a video blog now, or you can decide that you're going to doodle something every day, or your journaling can be done by way of expressive art. Where you're painting something, and some people paint the exact same thing every day and just see how it changes. It's up to you. Again, it's just a positive activity that is not going to bring you to those negative places that your helping and your compassion have brought you to. Other things that you can do are any form of exercise. I personally ascribe to martial arts because it has a certain Zen aspect to that. An excellent, I don't want to say easier, but less impactful martial art is Tai Chi, or arguably yoga as well, I believe is a martial art in the fact that it's the study of movement. There's several methodologies that ascribe to, your traumas being stored in the body and tension being stored in the body. And yoga is another great way to combat this. I should point out that anytime you're supposed to go into battle against something, and remember, compassion fatigue, it's an ongoing battle and something that you have to be conscious and aware of and fighting towards. A simple thing like staying hydrated. Some of the most cheapest and inexpensive things in life are the best for you. Water, clean and lots of it. Air, keep breathing, lots of it. And the final one that you have the ability to control how much you have of is sleep. It's cheap. It doesn't cost anything. Some of us from the PTSD crew side of the coin do have a problem with agitation in their sleep, and sleep can be a major aspect of the symptomology of how you become affected. And that can either be through intrusive nightmares or inability to stay asleep. Me, on a personal level, I wake up unfortunately, about every 8 to 12 minutes. Not often with full nightmares. Now that I have my service dog, Maverick, he's usually able to wake me up before the nightmares become intrusive enough that I have to panic awake and stuff like that. He usually just kind of wakes me up. Granted, I still wake up. It's just not in that panic of shock and maybe not knowing where you are. So if you do suffer from nightmares and flashbacks, this is the time that in the back pages of your journal, when maybe you're not quite aware, you can just kind of write a couple notes to yourself. If you're subject to panic attacks as part of your condition, write a couple notes to yourself. It's not real. Start your breathing. This will pass. Just certain things that you have to do when your condition does manifest itself. One of the, as you can see from looking at me, I kind of a high energy person. I don't have the ability to stand still. So oftentimes the ability for me to do a sit where you are or lay down form of meditation may not work. Okay, it may not just be on the horizon. So for me, another thing that I do is I get out and I do what's known as a labyrinth. And it's basically a predetermined path. A lot of people think it's a maze. But it's not. It's a predetermined path. It can be used metaphorically. Just put one foot in front of the other. Just look down, one foot in front of the other. Your path may go right and left and twist and turn, but you will find your way to the center. Much like the confidence that you have to have in your healing path. You have to be confident that that cloud of compassion fatigue that is now pervasive in your life does have a silver lining. It gives you the ability to now be more consciously aware of yourself and what's going on in yourself, and to make those positive steps and to really bring that self-care back into your life, and to take those positive steps to gain back that trust, that safety, that control, intimacy, and self-esteem that have been lost somewhere along the way for you helping and caring with other people. Taking those positive steps in your life, doing those positive activities, positive relationships. If we go back to my share screen here and we look at, sorry, I'm not very tech savvy here. Therapy may be an aspect that you do have to look into. I'm of the opinion as a therapist, and even before that everybody should be in therapy. But if you have something as pervasive as compassion fatigue in your life, then yeah, perhaps therapy, they will give you a number of tools. Support group and support network, a lot of people think them the same. They're not. A support group is a group of like-minded people that are going to be able to normalize what you're going through. One of the things that we have to deal with is that sense of isolation. And God forbid you tell your professional colleagues that the job is getting to you. We're supposed to be the helpers, the ones that step forward and carry the weight for our clients sometimes. We don't want to admit that weight has now weighed us down. I liken it to, they give you a backpack when you start, and every client you deal with is kind of a couple grains of salt into that backpack. And then sometimes you maybe have the heavies that you deal with, and that can be a brick or a bowling ball that kind of gets thrown in there. And eventually you just can't carry it anymore. And, was there one call or one client that kind of broke you down? No, it can be that final pinch of salt, and and the knees buckle and you collapse. So I guess as a way of kind of summing up, compassion fatigue, it can feel like sometimes it's not real in your life, and you're going to have those times of self-doubt. There's not a day that goes by that I don't think I'm somehow faking this PTSD, or that it's all made up and that it's not real, and that maybe I just gave up and didn't have the courage to fight against it. And then I then I take a couple deep breaths and I realize, no, there's a lot of professionals that are dealing with my injury. And the same thing can be with compassion fatigue. Even the name sounds like you're still trying to help, and that it's just you're just tired of helping so much. But it's actually more than that. It's taken away your ability to see positive aspects of your life, and has now been intrusive to the extent that it's affecting yourself. And it's not just a matter of taking a vacation, because we all know those emails are still going to be there when we get back, or nowadays we're going to be checking emails while we're on our vacation. So it's not just a matter of taking a vacation and coming back. Now, that being said, taking vacations and taking time out for yourself is there for a reason. And it's there to encourage you to take leisure time. And I encourage you to take leisure time. There was a period of time at work where I realized I hadn't been away on a vacation for 3 or 4 years. I had taken my vacation time, usually to go off and do other sorts of training, but I hadn't actually been on a vacation. We could also get some cash back for our vacation time back then. So, I often availed myself of that as well. So I guess as a way of closing off, compassion fatigue, you have to take it seriously. Sometimes you'll have those self-doubts, but you have to take them seriously. So the true healing path to the compassion fatigue comes in the awareness of it, and in you positively looking to take back your life. And that's done through those positive activities, and it's done through those positive controls. A key one being finding those boundaries in your life, and really learning how to enforce them. You really have to find those activities that you really enjoy. It sounds kind of cliche to find a hobby or learn an instrument or something like that, but indeed, that's what you have to do. You have to kind of widen your world view and your world vision, and you have to learn how to see the positive things. And sometimes we have to go searching for them. Those silver linings aren't always highly visible, but they are there. As a final note, anybody looking for more information on my organization, the website is valhallaprojectniagara.org. And it's been a pleasure having the privilege to speak to you folks. And I wish every one of you success in your healing journey, or in your greater awareness of this injury known as compassion fatigue. Thank you and have a great day. Namaste.
Luke Anderson knows how important it is to adapt our environment to the needs of the people in the community. Luke is the executive director for Stop Gap Foundation, a Canadian charity aiming to create accessible communities. He knows a lot about disability awareness too. We hope to enlist Luke in our newest campaign when this event is over. The campaign, Disability Etiquette Awareness and Training. It is our hope that disability awareness will increase our comfort, confidence, and competence in communicating with our clients, co-workers, and partners. He lives around the corner from the Toronto office, so we can see no end to this relationship.
Hello, everyone. My name's Luke Anderson. Hope you're enjoying this incredibly important event today, Compassion Fatigue 2021. Thank you for your interest in learning a little bit about me and my story and my journey with how compassion is a really important tool in my life. And I am very excited to be telling you about that and sharing those tools that I've developed over a good chunk of my life with you. So I want to tell you a little story. It was late October of 2002, and I was 24 years old. I just recently graduated from the University of Waterloo. I got my civil engineering degree there, and at the time I was really passionate about mountain biking. I was a very gifted athlete, and I wanted to move to the very best place in the country to live out a dream, living in the very best place in the country, if not the world, to mountain bike. And so I did. I packed up my car soon after I graduated, and I drove across the country to pursue that dream. And I landed in a sleepy little ski bum town called Rossland, nestled in the West Kootenay mountain range in British Columbia, and I connected with all kinds of other like-minded enthusiasts doing similarly, living out a dream, riding their bikes in the best place in the world. And it was on a ride in late October of 2002 with my good friend Johnny, who I'd met while I was living in Rossland. He and I were riding this really difficult, it was a really challenging trail that involved this feature that meant we had to jump our bikes over a big 25-foot gap. So I watched Johnny jump the gap. He landed safely on the other side, and it was so exciting witnessing him do that. I wanted to do that as well. And so I took my bike up to the top of the takeoff platform and did what I would normally do. I'd never taken on something like this before, but as in every adrenaline pumping extreme sport, the athlete has to listen for that internal dialogue in the back of the brain that waits for a confirmation, that inside yes, that inner green light. And I got that. But what happened next, I like to describe as this. I left the takeoff platform and essentially left my life as I knew it because I didn't make the landing. I crashed. I flew over the handlebars, landing headfirst, breaking a couple of vertebrae in my upper spine, causing a spinal cord injury. So in a split second, my life changed as I knew it, and I was all of a sudden introduced to a world that's really not well suited for someone that uses a wheelchair. So what happened that day was really the perfect concoction of just the right amount of force, the right angle, the right speed, temperature, lighting, sound. That stage was perfectly set for that to happen, in my opinion. And any adjustment to any of those variables, I truly believe that I wouldn't be here telling you this story today. So that day I handed in, essentially, I handed in my athletic identity. I truly identified as an athlete at that time and handed that in, lying face down in the dirt, unable to move a muscle from my neck down. And that day I was gifted a challenge, handed in my athletic identity for a challenge that I have come to recognize as a gift. And that challenge is to climb the ladder of consciousness from the lower rungs of shame and like guilt and fear and anger to the higher rungs of courage and acceptance and joy. So to climb that ladder, I've learned that I'm to put my arm around and sit next to and befriend the pain, the grief that I feel, the deep sadness, the longing that I have for my life that was, that anger that lives within, and the frustration that I have, and the fear of what my life looks like now, the fear of the trajectory of my life with someone with a profound disability. But these different parts of me, I've learned to recognize. I've learned to honor them, truly honor them, that gift. Embrace them with my arm around them with deep compassion. So to climb that ladder, I've learned that I have to consciously choose to think and to act in good, loving, compassionate, and positive ways that really uphold the well-being of myself and the well-being of others. And when I do that, I've found that I'm met with outcomes that are typically filled with goodness and positivity and love. So with this befriending gesture, with my arm around my pain and holding that positive state of mind, hard work, but doing so, I enable myself to climb up that ladder, and doing so up at the higher rungs, I'm met with acceptance, and I accept my life's challenges. I accept them. And from up there, the air is infused with meaning and purpose and tremendous value, and all metaphorically speaking, but up there the air is filled with that quality, and I breathe that in deeply every day. The capacity to work with the hard feelings associated with a difficult situation like a traumatic injury is something I truly believe we all have the ability to do. It's an innate quality as humans. It's a skill, though, that like anything new takes a really dedicated commitment to practice in order to develop. But with courageous practice comes the ability to rise up above those lower response levels, those lower rungs of fear and anger and frustration and grief and sadness, rising above those lower modes. And once we rise above them, we're met with clarity and understanding. And up there, we meet our creative potential. A lot of creativity that I believe and that I've witnessed in myself that meets me up there. So my journey through this process has allowed me to convert my frustrated energy around my situation that I hold around not being able, as a wheelchair user, to access space on an equal basis. So I've learned how to convert through this process, convert that frustrated energy into positive action. So yeah, since I've needed to use a wheelchair, I continually have been frustrated with not being able to access space on an equal basis. So everything from a single step to many of the spaces that we see in our communities prevent me from accessing that space that I really want to access. And over time, I've realized that I'm not the only one that experiences such a frustration. There's many other people out there that also experience similar frustration. Parents pushing strollers, delivery people, the elderly, people with temporary disabilities due to an injury or an illness. And in fact, we all encounter a shift in the way that we move around our communities just due to the aging process. I wanted people to understand this. The more conversations I had with people from these different groups, I started to realize that there's a need to raise awareness about this. There's a need to highlight how many barriers exist in our communities that I believe truly hold people back from reaching their full potential. I wanted people to start thinking about really great ideas that could help overcome and remove some of these big barriers that exist out there. I wanted store owners to realize the value of having a storefront that everyone can access, and I wanted to let people know that as Canadians, we have a human right to equal access, and so in 2011, through this process of converting my frustrated energy into action, I pulled together some friends and some family members, and we came up with an awareness raising strategy that involved pulling together some business owners with single stepped entryways in Toronto's Junction neighborhood. We approached them. We told them about what our plan was. We wanted to give them a brightly painted, deployable, so temporary access ramp that would help bridge the gap between the sidewalk level and their ground floor level. It was really hard to get those first 13 business owners engaged, because many of them told us that they didn't want a ramp because they didn't have any customers that used wheelchairs. I'll let you chew on that for a minute. It told us that there's a lot of ignorance out there, and it took a lot of education to bring awareness to those business owners about the value of having a storefront that everyone can access. And through that hard work, we did manage to get 13 business owners interested, and we built 13 really brightly painted deployable access ramps with our name stenciled on them, that being Stopgap, the website being stopgap.ca, stenciled right on those ramps. So whenever somebody saw them, those really bright painted ramps out there, they might be interested in getting to know more about why those ramps were on the streets. And so those ramps and the name was strategic, because the ramps aren't a permanent solution to this big issue. They're a stopgap measure, but they're also helping bridge a gap to entry. And so those first 13 business owners absolutely loved the ramps. Their customers loved them. All of the residents in the Junction community loved them. And it told us that we really needed to take this incredible initiative and take it to different communities across Toronto, and we did. And then we took it even beyond Toronto. We started hearing from people all across the country, these advocates and champions that wanted to adopt what we had done so successfully in Toronto. They wanted to bring our ramps and awareness raising messages to their streets. And so over the past almost 10 years, we have helped support communities across Canada to bring these important awareness raising messages to their communities. And we now have over 2,500 ramps bridging a gap to entry and communicating the incredible importance of inclusion and accessibility, the incredible importance of barrier-free design and spaces that everyone can enjoy. So this journey has led to an understanding that it's really the spaces that we live, that we learn, that we play, and that live, work, learn, play, and that disable us. It's not us that that have disabilities, but to me, it's really the spaces that we inhabit, the spaces that we interact with that are disabling. We each have unique and equally valuable lived experiences, and we each encounter challenges in life. That's just part of being human, that cause periods of suffering. But that suffering is also unique and equally valuable, because amidst the difficult feelings around our bouts of suffering resides this tremendous potential to make our lives and the lives of others better. So, like a seed, should we choose to water and tend to those difficult feelings with courageous compassion, the well-being of ourselves and the well-being of others will manifest and grow, and really great things can happen. So thank you so much for taking part in this hard work. Thank you for your interest in listening to all of the incredible stories today. Stay safe and keep shining that inner light of compassion to yourself, to those around you and beyond.
Michelle has been an advocate for mental wellness for individuals, families, and companies for over 20 years. She was introduced to me by Brenda Agnew, our Brenda Agnew. Brenda was so impressed with Michelle that she asked if she could be included here. Needless to say, I met Michelle at the college and was equally impressed with her skills and her ability to manage a busy schedule. Michelle has a way about her that makes you feel completely comfortable. We are extremely pleased that she agreed to be with us today to share her insight and her lessons learned.
Hello, and welcome to my session on how to manage compassion fatigue through all of this incredibly stressful and difficult time, and especially for those that are frontline caregivers and workers who are doing frontline work in healthcare, or for me, it's mental health. I'm just so grateful that you have given yourself the permission to take a time out and to take care of yourself. And frankly, I'm also quite honored that you chose my session to attend, because for me, more than ever, our time is so valuable, which is so weird, isn't it? Because our time is really valuable, except it feels like all we have is time. But no, it's really valuable and it's really important to me. So let me start by introducing myself. My name is Michelle MacIntosh, and I have been a mental health practitioner centered out of the Niagara region for the past 22 years. And I work full-time in mental health. And I have kind of a varied job. I work for an organization, and I have a private practice, and I also teach communications for police officers and students looking to get into policing online as well. So I have a varied background that's very busy, just like most of all of us do right now. So today I'm going to be talking about my experience, both personally and professionally, with self-care during COVID. And for me, it has been quite a journey. I'll let you know that. So when I was sent home in March, I, have been working from home ever since. And at first I was able to manage. My adrenaline kicked in. I was able to figure out what I needed. I was able to go for walks and get outside and do all of the things that I was able to do. And then November hit. and I had a pretty big crash. I was able to get through the day. I was able to do the things I was able to do, but my energy was low. My feeling of being in a funk and my wellness, my emotional wellness, my physical wellness was really at an all-time low. So I had to really sit and evaluate what I was doing and how I was living and taking care of myself during a pandemic, especially as a mental health worker who was hearing these stories over and over and over again. So I thought what I would do with you today is share my get up story. You know, I always say to my clients, falling down and failing is never a problem. What always interests me is how we get up. So that's what I would like to share with you today. How I went from pushing all the time, go, 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 the 150% person, to someone whose motto is softly, gently we move forward. Just softly, gently. For my friends and for my family, me and the word softly and gently don't tend to go together. I'm very driven, very focused, always have a high level of goal setting and really push. And I realized in November that all of my self-care tools didn't apply anymore. So I want to talk about that. And for me, it starts with sort of redefining what self-care is, because self-care itself is really challenging during this time because it doesn't really make sense. The first thing I would invite you to do when you're thinking about self-care is think about the community you're in. Because self-care has been sold to us as an island. Right? It's this idea that we do self-care, and if we're not doing enough, if we're burning out, it's because we're not doing enough self-care. We're blaming the victim. When I really want you to embed and think about self-care for yourself during COVID, and quite frankly, for the rest of our lives, in terms of community care, because you cannot self-care yourself out of a broken system, out of a community that doesn't care. So to do that, I sat down and took a look at what was happening in my communities. And because I'm a social worker, I love systems. So I looked at post-secondary, where I work full-time, and the system of post-secondary. I looked at my family system. I looked at my role within these systems and realized that my personal overburdening of myself, because the system likes to overburden pushers, right? Type A personalities, the people they know will get it done. You know, when I burnt out in the fall, I had 3 projects on the go. All of the things that would have worked for me a year before, I would have done them off the side of my desk. I wouldn't have had a problem. But the systemic issues that I was facing, working remotely, not having all the things I need, was really a problem for me. So whatever system you're in, I just want to acknowledge that there may be something happening for you that you can't self-care yourself out of. And if you're in that situation, we put that knowledge to the side and we don't blame ourselves for struggling with our self-care. So I really wanted to figure out then what it was that I needed. So what I did was I looked at how I existed pre-COVID. And I realized how I got my self-care. My self-care was about connection. As an extroverted extrovert, how did I get my connection? How did I fill my cup on a daily basis before COVID? And then I was able to sit and go, oh, no wonder these things do not exist. The simple act of walking from my office to the bathroom and talking to colleagues and clients and people I care about doesn't exist. So how then can I reframe and rework my experience so that while I still need those things, I understand that I can't get them and both exist at the same time? That was groundbreaking for me in my self-care journey and my ability to feel good again. It was understanding that the things that I normally needed and I normally got no longer existed, and I needed to look for different solutions. So when I do that, the idea of self-care then fits into a whole bunch of different things. But first, it really, to me, started with that piece. Self-care is a relationship with ourselves. And I don't think I'd ever really thought about self-care. Self-care was something I did. Self-care was something we checked off, but I never thought about it in terms of self-care being a relationship with myself. That thought in itself was a game changer for me. So it was no longer a to-do item. It was a, how am I existing? How am I being? How am I truly accepting who I am? A good friend of mine at work, we always laugh and talk about how we are like those 150% people. We give 150%. And I got to tell you, the first thing I did was give myself permission to give 75%. And, the saying orange is the new black, that television show or whatever, for me, 75% is the new 150. That is where I can manage. I just have had to build more spaces into my life. And I've had to be very intentional with that because I don't have a job that intuitively builds spaces in. I don't have a life that intuitively builds spaces into it. I've had to construct that time because my relationship with myself demanded it. So when you're thinking about how to create a relationship with yourself in terms of self-care, it's based on acceptance that this is what I need. It's okay that the people who live in my house cannot fill my cup. It's okay that my relationship with my husband is not enough to sustain me. It's okay that my introverted adult children who live with me get sick of me. It's okay that we struggle. That level of acceptance of ourselves in this new world has never really happened before. We've never really had to take a look at who we are at the core and see everything we did to support who we were taken away from us. And it doesn't look like that's ending anytime too quickly. And I just keep seeing it as the gift COVID gave me. It stripped me of all my normal coping skills, and all I was left with was myself. And I was able to rebuild from there. So the types of self-care, once you understand who you are, and that does take some processing, right? It takes some paper and pen time, in my, therapist opinion. Maybe talking it through with a therapist, a friend, someone that you can do that with. Like, who am I? What was life like? How did I get my needs met? And what is missing? And then I broke it down into the types of self-care. So physical self-care, social, personal, emotional, spiritual. And then there's the environmental and the professional. But again, I put those two together because the caveat is, if you're in a system that doesn't allow you to be okay, or to take it's so relentless, then you just have to acknowledge that and leave that at the back burner and just understand. I really believe that my clients who've accepted their workplace, be them working in long-term care, be them managers in the health system, once we acknowledge the brokenness of the system right now, we are able then to find some space and some compassion for themselves. And it changes around their level of personal stress and personal responsibility to fix a broken system. So how do you do physical self-care? So for me, it's all about the holy trinity with self-care. Sleep, which COVID sleep has really become difficult lately. I hear time and time again, people are having very interesting dreams. Things are coming back up. I woke up writing a text message to a friend about something that happened 3 years ago. Our brain development is different because we're not having these different situations. So sleep is very different. I don't know if you've seen some of those blue wave glasses that you can be, you know, receive less of the negative rays from your screen so that you can be better to fall asleep. That's there. For me, I have a very clear bedtime ritual. I have a bath, I read a book, I have a water or a tea, I light a candle, or I do my aromatherapy because I need that. I'm useless without sleep, and I work on that. I also realize that for a lot of us, we're not moving as much. So when we're not moving as much, our need for sleep goes down. So that's really important. So sleep, movement, and then nourishment is another thing that I feel like we need to look at with physical self-care. And I use the word nourishment with very intentional purpose. So for me, nourishment is a way of looking at how we feed ourselves based on what we need in that moment. And it's intentional. So we're not using food as a drug to drown our sorrows or to drown our stress without intention. Of course, I don't know about you, but of course I still do that when, and for me, it's like if I'm angry or stressed, I know that I just eat intentionally. And I'm, you know, as I grew more mindful about my eating, one of the things I would do is say, I'm angry and that's why I'm eating. I'm not hungry at all. And I would say it out loud. And my kids would look at me like, okay, you're crazy, but that's okay. I get it. You're you. But it's important to understand nourishing. So sometimes we do emotionally eat. And sometimes nourishment is a smoothie or a salad or some chicken or whatever it is that you need to fill your body, because we need those macronutrients, we need vitamins, we need things that are good for us. We need fiber. We need food that nourishes our body and also our gut, because a lot of the things we need for our brain are produced in our gut. So we need a healthy system in our stomach and our intestines, and we need to be able to go to the bathroom and do all those things. And it seems ridiculous, but it really isn't, because movement and sleep and nourishment are that foundation that keep us well to do that. The other type of self-care that I personally am big on is, what do we need to manage our emotional care? Especially when you are dealing with confidential situations and challenging situations day in and day out that are relentless. How do we get our emotional needs met? How can we manage them ourselves? Everyone knows their body and their system different. And everyone knows, extroverted people usually need connection to do that. Introverted people usually need some time to process internally, but there's always a bit of both. Human beings are connected by nature. And what lockdown, specifically now when the lockdown is so strict, has done to us is it's made those connections more and more difficult. And they've made it harder and harder for us to get our emotional needs met. We need touch. We need connection. One of the things that I highly encourage my clients to do is give themselves every single day a little bit of a hug. And while you might live with kids who are climbing all over you and doing all sorts of things with you, or you might have a partner that's very touchy and that feels good, there's something about mindfully taking a moment, and you might want to, if you're alone, you might want to just try it right now, just that connection, just to go and just to feel what it's like in your body to release things. I know for me, especially if I've been listening to a lot of trauma in a day, or students and clients who are facing some really dark self-harming thoughts, I'm always cautious to be able to remember to take that time, because when I worked with others, I would get my emotional needs met after a difficult session by going into my friend's office and sitting down and connecting. I don't have that anymore. Even, if I could, it's, confidentiality and all of the other things. There's no one I can just share with the very difficult things I hear day in and day out. So I've been very intentional to be able to figure out how to manage that. I really have connected with friends. I make sure I reach out to people, but I also make sure I have some time alone to process. And as an extrovert, it's been a new way. I would have never done that before. So for me, mine is my morning routine. I get up, I meditate, I journal, and I work out. And that's the gift of COVID, is that I don't have to be showered, and I don't have to be ready, and I don't have to be anything at, I don't have to be anywhere at 8:30 anymore. So I have a little bit of leeway with that, but I'm also, for me, I'm an early riser, so that works. Tell me I have to go for a run at 9 o'clock at night or do my journaling at 9 o'clock at night, and that's just not going to work with me. And that's what goes back to the very beginning, that self-care is a relationship with yourself. Those things might sound horrid to you. You might want to listen to a crime series before you go to bed, and that is good for you, or a podcast on true crimes. That is where self-care is, that relationship and that true need to just accept the quirks that we all have, what makes us unique, what makes us tick, and know that feeling those and feeding and nourishing ourselves is very important and it's okay. And we can give ourselves permission to do that. So socially, emotionally and socially, well, they're really good friends, they're a little bit different. And each of us has a little bit of a different need socially. So for me, I need, when I sat down to evaluate how I got my needs met post-COVID, I realized I was more like a little bird, and I would eat little pieces of birdseed versus, like, I always say I'm a Labrador retriever because I'm that extroverted, but how I nourish myself is more like a bird. I just eat little pieces of birdseed from lots of different people all day, and that's how I get my needs met. So my phone can have 10 text message conversations going on at once, and I can have 2 weeks of FaceTime meetings and or Zoom connections with my cousins and my friends and my colleagues, because I need that much of a variety to get my needs met. I didn't realize that the Tim Hortons lady that I saw every day was so crucial to my wellness before, until that wasn't an option. So again, just being okay with your uniqueness. For someone else, that is a nightmare to think of having 10 text conversations going on at once. Like, get away, leave me alone. For me, it's like a dream. And we need to be able to accept that we all have these different things without any negativity towards them. At first, people in my house were like, "Mom, you're on your phone too much." And I'd be like, "Yeah, but I got 10 conversations going on right now, and I don't want to stop any of them because I can't get my needs met the way I used to. And I've accepted this is who I am. And I accept that you need your phone turned off and hidden in a drawer to be okay." They're not the same, but the outcome gives us both what we need. So really understanding who we are and understanding the different kinds of self-care we need really allows us to have this opportunity. So once we understand our self-care, then we can look at one more thing that I think is really important. And if any of you know dialectical behavioral therapy, you might know the concept of a chain analysis. So when I was looking at myself and what was going on, I really started to see that things that used to never upset me, there was a reaction happening inside of me that was more difficult than it used to be. So the best example I can give of this is one we can all probably relate to. It's the idea of a mom or a parent. When a parent comes in the front door and there's backpacks and books and boots and coats and you're stumbling over them. And one day you can come home and just be like, "Guys, can you guys come and pick up your stuff?" Another day you can come home and you can lose your ever-loving mind about it. The situation that happens, that event, is not actually the problem. The problem is that we have a different level of vulnerability. And those of us who used to be able to manage our reactions to those kind of events all of a sudden, because we're more vulnerable than ever, are left feeling more frustrated. So currently during COVID, I will be honest that mine is people's inability to complete their chores before I have to start making dinner. It's not something I ever really would have lost my mind about. I would have before just been like, yo, guys, like, let's get the kitchen cleaned. Who was on emptying dishwasher? Who's, and I'm going to go put on my evening pajamas and then I'll make dinner. But I was finding that even if I didn't yell, I was very irritated inside. I felt disrespected. I felt unheard. I felt unsupported. And really, my adult children were just doing the best they could as well. And they also they weren't used to this. They weren't used to having to do that. My daughter came home from university and she was used to being able to clean up things on her time. And all of a sudden, mom wanted it done on her timeline, on my timeline. And it was a big challenge. So understanding that our workplaces, our normal routines, and the weight of our jobs creates a new level of vulnerability in our lives is a really important thing to allow us so that we don't have these reactions to things that we don't want to have. We don't want to have these behaviors and then these consequences. I don't want to feel resentful to these wonderful human beings that I'm living with because I'm so vulnerable that I'm taking things personally. I don't want to have this feeling of resentment for people not doing things for me and quick enough for me in the workplace or, and when I was at my worst in November, I even felt sort of resentment. And if I'm really honest, when, a challenge with I just didn't have the capacity inside of me to be able to be as supportive as I wanted to be. And that's when I realized that I needed to change things. And I really needed to reevaluate my relationship with myself so I could take care of me for all of these other people. I hope that makes sense. The last thing that I did was I understood the role that rest needed to play in my life. I'm not a normal rest person. I'm a normal go 100 miles an hour, fall into bed, fall asleep, get up in the morning and start over again. And I realized that this wasn't working for me. So I started to investigate the kind of experiences I was having and what kind of rest I needed. I found that there was times when I was working that I needed some mental rest. So if I was listening, I don't know about for you, but for me, because I'm working virtually, sessions on the computer or on the phone, specifically on the phone, when I have to active listen so hard, it's mentally exhausting for me. I needed rest. I needed sensory rest. Granted, I just said I text a lot of people a lot of times, but I also have a very deep need to have sensory rest. So for me, the sensory rest gets built in my morning routine. There's no online presence. There's no being on my phone. It's me and my journal. It's soft lighting. It's a candle and a coffee. Even my coffee routine. So the coffee goes off and I smell it and I pull out the drawer and I pick my mug and I sit there. I did it today. I was like, oh, what mug do I want to drink my coffee out of? And then when I pour it in, I feel my cup get warm. I smell it. I take the first sip. Even that moment is a sensory rest. I'm getting my needs met in a different way. There's also the need for creative rest. Creative rest is when you're working on projects a lot and you can't come up with the next thing. I find post-secondary students and high school students and elementary students sometimes need creative rest, and we haven't thought about that. We haven't thought about that coming up with another project or another to do is too much and they need more spaces in between. So maybe, you're struggling with how to start a project or how to finish a project and just feeling exhausted with that piece. And then we need some creative rest. There's also emotional rest, and then everyone's favorite, physical rest. And I think sometimes when we think about rest, all we believe is that we just need to have a nap and it'll happen. For me, rest includes connecting with people who make me feel good. It means going hiking. It means going in nature. It means lying in my bed and reading. It means cooking with my earphones in and a podcast on. Rest is about how to give ourselves a break from some of the things that are happening to us. And finding a creative way to rest is really important. And it's also so much more than just sleeping. If we only think we need to sleep, then we're never going to feel fulfilled and like our cup is full. You know, when we wake up exhausted day in and day out, sometimes it's because we're not sleeping enough, but oftentimes it's because we need other kinds of rest to be able to sleep more or to be able to feel fulfilled. So how I would like to end our session today is by doing a 5-minute breathing meditation. Meditation and mindfulness for me are one of the solutions that fit a lot of the bills that we're talking about, both in self-care and in rest. When you go on a meditation retreat, you'll find that your sleep changes because you don't need as much sleep, because meditation actually rests our brain, actually rests our body. It mimics these things so that people need to sleep less. Meditation allows our central nervous system to become calm because we get to finally, for a few moments, turn off our fight or flight responses. We get to turn on our parasympathetic nervous system, which is so really very important. So what I would invite you to do is I would like you to sit in a position that feels really good for you. Anything that works. I'm going to watch the clock and I'm going to time 5 minutes. Now I usually start by ringing my singing bowl, but somehow I've lost my little dinger. So I'm going to hit it with my finger. Let's see if it works. And then you can just follow along. It worked. So what I would invite you to do now is just close your eyes if you're comfortable. I would invite you to listen to the sounds in your room, wherever you are right now. And if you have headphones on, that's just fine. And now I would invite you to feel the support that you're receiving from where you're sitting. A lot of times we feel tossed about in the world, so it's important to find where we're rooted. How does your chair feel? Are your feet on the ground? Is your back supported? Perhaps your hands are resting in your lap. Just notice the support you're receiving right now. And you can let all the sounds go. You can let go of focusing on your sitting. And take a moment to notice your breath. You don't have to change your breath, just notice it. And maybe there's a place in your breath that you can just hang out comfortably. So for me, it's the sensation of the air as I inhale and exhale at my nostrils. So when I breathe in, it feels cool. And when I exhale, I focus on just how slightly warmed it is. Other people like the feeling in their chest or their tummy or their throat. It doesn't matter. Just settle on one place in your breath and focus there exclusively. And if you've gotten distracted and your thoughts have taken you away from your breath, that's perfectly normal. That's what we do. We think. Acknowledge the thought, let it go, and find your way back to the breath. If you find it hard to stay focused, maybe you can count 4 as you inhale, hold for 4, and exhale for 4. Otherwise, just stay focused on your breath for a few more minutes. Before we end our meditation, I'd like you to let go of your breath and just feel the rewards of your hard work. Just experience for a moment what it's like post-meditation. And then at the sound of the singing bowl, you can flutter your eyes open. Again, I want to thank you so much for choosing to spend a half an hour taking care of yourselves. I hope that the information I've given you is helpful. If you would like, you can find me on Instagram. My handle's Michelle MacIntosh, but my Instagram handle is Symmetries, SYMMETRIES. I would love to connect and do this journey together, because for me, the journey is about compassion and connection. Thanks so much.
A few years back, a relative of mine had experienced a loss of a newborn. I was telling my friend Brenda Boosfield how devastated the parents were and how difficult it was to manage the memorial service. Unexpectedly, Brenda had told me that her sister, Lynn McIntyre, was a co-founder of a group called Precious Angels of Niagara, and the group provides gowns to still-term babies from reconfigured wedding dresses. Brenda was in touch with her sister and Robyn Moore, the partner in the founding of this service. The rest is history. Today, Robyn Moore will modestly represent the most dedicated group of volunteers that I know. Our relationship spans 5 years already, and dedication to this group has grown, as has the service that they provide. If you want to know more about this group, please link into our Butter Torts podcast that features Robyn. There'll be more about the Butter Torts as well in our break.
Hello, my name is Robyn Moore, and I'm from Precious Angels, Niagara. We are a charitable service that we started back in 2014. We provide angel gowns and wraps for early term losses and stillborn babies. We started doing this I wanted somewhere to donate my own wedding dress, and I saw a link on Facebook that was about a group down in Texas that collected donated wedding dresses and turned them into angel gowns. And they were going to donate them to one NICU down at a hospital in Texas. So I put on my Facebook page that if there's something like this in St. Catharines, I'll donate my dress to you. But one of my friends worked at the hospital, Lynn, who started Precious Angels Niagara with me. She went into the labor and delivery unit at St. Catharines Hospital and asked them if there was anything like this service in place. And they said no, there wasn't. But actually the case manager got quite emotional and said, you know, we wrap the baby in a hospital blanket or whatever small enough that we can use. But we would love for there to be a program like this that we could offer at the mums. And she teared up and everything. Is quite an emotional time. So with that, we decided, okay, a couple more friends got on board and said, okay, well, we'll sew some angel gowns for you. So with that, Precious Angels Niagara came about. And so we started with my wedding dress and Lynn's wedding dress, and we were just going to make maybe 20 angel gowns to donate to St. Catharines, and that would be it. But through word of mouth and Facebook, now we donate these gowns to hospitals, funeral homes, and bereavement support groups all over Ontario. So at hospitals, we donate them, of course, the nurses, social workers. Nurses have told us that they're very impressed with what we provide. And they're also very grateful because it's a way for them to present the baby dressed as a little angel. And rather than a blanket. Or social workers have also told me that when it's appropriate, when they can, they prefer to let the mom pick an angel gown from the selection that we've provided to the hospital, because that's one of the decisions the mom can make for her baby when everything else was so sadly out of her control. We've also had funeral directors tell us how it helped them when they were presenting the baby at the funeral home for the memorial service. It helped them and it helped the parents to see the baby dressed, and for remembrance photography, and the parents would go away with cherished memories of their baby dressed as the precious angel it is. So we have, this is a little sample of one of the little angel gowns that we have made for a little baby girl. It's got a precious angel tag on it. It has a detachable charm that the parents may keep in the baby's memory box, and then a little crocheted bonnet so that the baby's totally wrapped up in love. We haven't forgotten about the little boys. We have a vested style for the precious angel baby boys. Got a little vest. These are from donated brocade wedding dresses, and a little bow tie and a little hat. Now we are, we have donated to families, but we mostly donate to families through hospitals and funeral homes. So if you would like us to send a selection, again, they're completely free of charge. They're donated. Everything right from the start is our volunteers donate their time, and then we donate them wherever there's a need, and we send them out. Don't charge for delivery by courier. So you can get in touch with us by email at preciousangelsniagara@gmail.com, or please like us on Facebook at Precious Angels Niagara, or where you'll see more of what we do and how we can help you and the families that you serve. And I'd also like to thank Brenda Agnew and Diane Henderson from Gluckstein for giving us this opportunity to tell you a little bit about Precious Angels Niagara and how we can help you with the compassion fatigue that you must experience. Bye for now.
Gluckstein Lawyers is a firm rooted in compassion. Our clients come to us in a time of crisis when they need help more than ever before. And we are fearless advocates for them in their time of need. Every day, we have the privilege of witnessing strength and resilience in our clients. Our promise has always been to offer full circle care and support to those who walk through our door. We pride ourselves on treating our clients and team members as family. A family stands together through hardship and are stronger when they come together. We are committed to the communities we serve, and we are proud to be advocates of change and to play our part in building a more supportive and empathetic world. So thank you all for attending, and we hope to see you again next year.